Okay, hi everybody. This is Module 4, which is called Nutrition, Sports Medicine, and Psychology of Exercise and Sport. And if you look at that list, it looks like a whole bunch of different things that sort of got smushed together in one module because they didn't go anywhere else, and we just awkwardly lumped them together. And you know what? That's exactly what happened. So let's look at them one at a time. How should nutrition change to meet the demands of exercise? And what is sports medicine? And finally, how does psychology apply to exercise and sport? And so, if we just look at the first one, how should nutrition change to meet the demands of exercise? This is something you may have already thought about. Nutrition is a big piece of things like exercise, healthy living, weight loss, and so forth. You're already probably familiar with dietary guidelines in general for we might call it the general population. And every couple of years, you'll find that research will dictate new and revised things. And so you see marketing campaigns for example, like choosemyplate.gov. And in the past, it was myfoodpyramid.gov and so forth. And there will be new ones down the line. And these are guidelines that are given out to the general population for, hey, if you want to stay healthy, if you want to eat right, here's some guidelines for you. But what if you're an athlete? And what if you're engaged in systematic and effortful exercise? How should that change, or does it change? And so here's a picture of nutrition for exercise. We need to talk about how those things might change if you're an athlete and if you are increasing the demands on your body. And as I look at that picture, the first thing I think is, where's the meat? All right, what is sports medicine? Medicine is a broad-ranging, grouping of professions and expertises. We have surgery, we have general physicians, we have pediatricians, and so on and so forth. We have therapists of different type. But what about sports medicine? What if it's applied specifically to exercise and sport in terms of athletes and so forth? And there's a profession called athletic training that a lot of people have, when they think about it, they think about people who run out of the field and help athletes when they get injured. And so they treat injuries as they happen. That acute injury as it happens in the course of play. And that's true, they do. But a lot of people don't know that athletic trainers also do a lot more than that they work in preventative medicine, that they work in therapeutic treatment and modalities, that they help people rehabilitate from injuries, and so on and so forth. And so we'll talk about that and the other professions that comprise sports medicine because it's a really big, wide-ranging umbrella that takes in a lot of different disciplines that all work together to help athletes. And finally, how does psychology apply to exercise and sport? Psychology is something you probably already know about. And if you go do a little sports psychology Google image search, you find ridiculous things like this. I just want to point out as a disclaimer that this is not accurate, that your brain actually is not capable of lifting barbells. So psychology sometimes we think of as sitting with a therapist and talking out our problems and so on and so forth, but it takes in a little bit more than that. It talks about things like our personalities, our sources of motivation, what it is we think we can and can't control, and so on and so forth. And those are general principles of psychology, and then they can be applied specifically to sport. Sometimes we think of sports psychologists as people who help athletes to reach their highest levels of performance, and that's true. There are sports psychologists that do exactly that. But it turns out that there are psychological dimensions to things just like sticking to an exercise program, so-called exercise adherence. And there are psychological components to things like recovering from injury and so forth. And so we'll talk about that. So in this module, we'll do a few things. We'll discuss nutrition for sport and exercise. We'll explore sports medicine and all of its attendant professions. And finally, we'll examine psychological principles specifically as they apply to exercise and sport. So that's it for this intro. You go ahead and dive into the module, and we'll meet up again in the discussion.